Welcome to the Dental Breakdown Show. This show is where we break down issues in the dental marketplace. It's April 23rd, and this is podcast 2 of 2. My name is Christian White, the CEO of White & Associates Practice Consulting, Better Business, Better Dentistry. Today we are talking about the specialty of orofacial pain with Dr. James Fricton. Dr. James Fricton, why don't you tell us a little bit about yourself?
Thank you, Christian. Yes, I'm a professor emeritus at the University of Minnesota, trained at University of Iowa and UCLA in pain management, anesthesiology. And at the University of Minnesota, we developed an orofacial pain program that included graduate training, advanced specialty training. It also included a clinic to provide interdisciplinary management of patients. And I also set up a clinical practice called the Minnesota Head and Neck Pain Clinic, which I'll talk about today. So right now my focus is really on developing strategies for which to really help patients with all types of chronic pain, and particularly to focus on preventing chronic pain. So thanks for inviting me.
You're welcome. It's nice to have you back on the show. And I'm looking forward to a lot of great information you're going to share today, which leads me to my first point. So the new specialty of orofacial pain, this is something that you've been working on and you put a lot of time and effort into it. How does this area benefit the private dentist?
Well, that's a good question. On March 31st of 2020 this year, the ADA National Commission on Recognition of Dental Specialties and Certifying Boards recognized that we met all of the requirements for specialty and acknowledged that and approved a specialty in orofacial pain. So this is a very important move on the part of the dental profession and the American Dental Association. We've been working on this for the last 30, 40 years or so in terms of developing the field, developing an American Board of Orofacial Pain, developing clinical practices in the area, and making sure that our graduate programs, we have about 12 around the country right now, they're all CODA accredited by the Commission on Dental Accreditation. And so it's a long process of really gaining recognition and approval of specialty. But the most important thing for dentists that we all need to know about with regard to orofacial pain is that this is a highly prevalent problem. 40% of the population has some signs and symptoms of orofacial pain disorders, including temporomandibular disorders, headache disorders, neurovascular, neuropathic pain, persistent dental pain, ear pain, neck and shoulder pain that's associated with it. All of these conditions are very common, and we see them on a daily basis within your dental practice. We want to make sure that everybody, all dentists, as well as other health professionals, really understand, recognize, prevent, and do early intervention for these conditions.
Okay. So if I am a private dentist, Dr. Fricton, getting involved with this new specialty, why would I want to do that? How would that bring value to my practice and to my patients by exploring this specialty?
Well, this specialty is important for the general dentist to bring additional value to the practice, and the fact that we bill everything on a medical insurance plan. And so dentistry historically has always been paid by procedure. Within healthcare and within health plans and medical plans, we're reimbursed by time. It takes time to really evaluate, diagnose, and manage patients with orofacial pain condition. And we integrate many evidence-based treatments together to provide the best care. So within a general dental practice, if you have 10, 20, 30% of your patients with headaches or jaw pain or clicking and popping in the jaw joints, historically we've always thought, well, that's related to occlusion and we treat the occlusion. Well, now we know that treating the occlusion does not necessarily resolve the pain. And we've done a significant amount of research looking at what are the causes of TMD and other orofacial pain conditions, and find that they're multifactorial. And so with the general dentist, there are tools right now out there that we've developed so that general dentists can really take a portion of their practice and implement that in TMD and orofacial pain, particularly the simple, less complex patients, and provide, for instance, there's a tool called Speed to Treat. It's on the website speedtotreat.com. Speed 2 treat. And it is a strategy for which to provide immediate care for patients who have TMD and orofacial pain conditions. We also, for chronic pain patients, we have tools such as the PactForPain.com, which is a self-management training program for patients to both identify and to change all the different causes of TMD and orofacial pain. So those are a couple tools that dentists can use within their practices to really broaden their care. Now, of course, we also have and would like most dentists to recognize the fact that there are complicated patients out there that have multiple what we call comorbid conditions. They have neck and shoulder, they have headaches, they have jaw pain, they have neuropathic pain. And these are patients that require more of an interdisciplinary care, which we integrate physical therapy, sometimes health psychology, health coaching, to implement self-management, as well as splints, medications, sometimes injections. And they require a more interdisciplinary, integrated program to really help manage those patients. And so all general dentists need to be able to identify and diagnose, do prevention and early intervention. And you should be able to be reimbursed by medical health plans in addition to dental plans.
So then obviously the reimbursement on a medical plan would be, much higher than if the dentist were to do this just through a regular insurance plan, correct?
That's correct. Because we get paid by time for our office visits and consults, we can have a portion of our practices involving medical insurance, and the reimbursement is by time comparable to that with physicians. In fact, in 1987, we are the first state in the country to require that all medical health plans reimbursed dentists on an equal and integrated basis as physicians for TMD and orofacial pain conditions. So it was a very landmark, and since then, every state now reimburses dentists for medical insurance for orofacial pain conditions, and including Medicare and Medicaid.
Okay, that's good information to know that. So for the private dentist, then, as well, as for you, then it's all about dealing with chronic pain and ending the chronic pain that a lot of these patients are dealing with. Is that correct?
Well, yes and no. We deal with, as I mentioned, 30 to 40% of the population has a TMD or orofacial pain condition. And we include within that sleep disorders such as snoring and sleep apnea as part of the care model, because it's all involved in the orofacial area there. And so the patients often start out with acute pain. And interestingly enough, one of the most important causes of TMD pain is going to the dentist, having your mouth open for an extended period of time for too wide. And that will strain and injure the joint and the muscles of mastication here and here. And with that, about 40% of our patients, the onset event was after they went to the dentist or had their wisdom teeth extracted or had their mouth open for endodontic treatment, etc. Now, in those situations, it's an acute pain problem. However, and this is the sad fact, multiple studies have shown this, 50% of the people who have pain that's 1 month after onset still have pain 5 years later. They become chronic. Half of the patients that have started out with acute pain become chronic pain, and much more complicated. And the reason for that is because there are so many patient-centered lifestyle factors such as clenching and grinding, or stress, or poor posture, dietary factors, lack of sleep, anxiety. All of these things generate a significant amount of muscle tension peripherally, as well as within the brain. It sort of turns the volume up on pain, and so it becomes chronic. And so what we need to do as dentists, as well as is recognize the fact that all dentists are going to see these patients when they're in the acute phase. Now, whether it's caused by chewing on something, or whether it's caused by singing or yawning, or a blow to the jaw, or whiplash injury, patients first go to their dentist when they have pain in the face and the jaw. Sometimes they go to emergency rooms, but frequently the dentist is responsible for the management. So we need to really recognize these patients early and know what to do, and that's why we developed the Speed the Treat program, so that we can put in a splint, but we also need to go through the exercises, change the behavior patterns that might be driving delayed recovery, and really increase the success of managing it at that acute level. So it's not all chronic pain. It may be acute pain, which we have, and dentists have the ability to manage. Now the question is, how do you get reimbursed for that? And that's why we do have fees associated with that. And we suggest that we bill it medical, and there's a whole training program on how to do that. And every dentist needs to learn that. And that's where consultants such as yourself can really be very helpful.
Okay, wonderful. All right. Thank you very much for that. So let me move on to our next topic real quick. How does your clinic, your head and neck and pain clinic, deal with a lot of these issues, and really bring value to the patients who have these problems?
Well, yes, I started the Minnesota Head and Neck Pain Clinic back in about 1990 or so, and we've been operating now for 25 to 30 years or so, and it's a very unique clinic throughout all of Minnesota and the country, because we started it originally to bring physicians together with dentists to provide the highest quality evidence-based care and really begin to improve access to care. So being at the university, we had a clinic, and we had physicians and physical therapists, psychologists, oral surgeons. We all worked together. And there was a feeling that all these patients have to be referred to the university. Well, we felt that no, if we're going to really improve access to care, remember, 30 to 40% of the population has these problems. We need to implement this strategy in clinical practice. And so we started the Minnesota Head and Neck Pain Clinic with Dr. Mary Kwan originally. Now we have a physician, Dr. Al Clabell, Miles Belgrade, as well as physical therapists, health psychologists, and health coaches to really support us in providing that evidence-based care. So and we call it not just treatment of a problem. We believe it's more of a transformative care model where you integrate treatment with training of the patients to reduce those risk factors that are delaying recovery and causing this 50% of the patients to become chronic. And they're complicated. I mean, one of the most common ones, of course, is clenching and grinding. And every dentist needs to help patients reduce clenching and grinding, whether it's with a splint, but as importantly is how to change that behavior pattern during the day of touching your teeth, bringing your teeth together, etc. So it's a very common habit we all have, but when you have an injury to the muscles or joints or the nerves in the area, clenching is going to cause a delayed recovery. And so as part of Minnesota Head and Neck Pain Clinic, we provide this interdisciplinary, integrated, and transformative type of care. So we have training programs like the PACT for Pain, PACT for Pain.com, We have coaches that work with patients over the phone using telehealth. We have physical therapists that work with patients, giving them exercises, working on improving range of motion, both of the jaw and the neck, because we see mostly patients that have jaw, head, and neck pain problems. So when you have a jaw problem, frequently you have headaches, and you might have neck and shoulder also, and we work together. So I'll give you an example of a patient that we treated recently. This was an 81-year-old gentleman that I saw, and actually he didn't seek care with us. He happened to be in the room when I was managing his daughter and his wife, who had jaw problems and headaches and neck pain. And after about 2 months, and he would come to every visit, listen to what I would say, he came to me and says, I wonder if you could help me. I have had headaches and jaw pain every day for the last 65 years. Now remember, he's 81 years of age.
Wow.
So he started this when he was 16.
Wow.
And so I said, of course, confidently, yes, we're very happy to help you. We have to identify what's causing these symptoms, these problems to continue over time. So we integrated a training program for him. We also gave him a splint. We gave him some medications to relax the muscles while he's sleeping. We did a lot of physical therapy, both on his neck and his jaw. And he had a coaching support for implementing self-management. And surprisingly enough, or not surprising from my perspective, in about 2 months, his headaches came down from daily to about once every 2 weeks. And this was the surprising part about it. He came in and he was so angry. I said, why are you angry?
Why? Yeah.
You shouldn't be angry. You should be delighted. He says, I'm angry because I'm 81, and if somebody had told me these things when I was 10 years ago or 20 or 30, 40 years ago, I didn't have to go through my entire life with jaw pain and headaches. And he learned to live with it. He was a vice president of a major company here in the Twin Cities. But it's one of those things that we can prevent this from happening. And every dentist needs to understand how to do that, and to refer patients if they don't know how to manage it within their own practices. And so Minnesota Head and Neck is a unique clinic because we do treat both simple and acute as well as complex. We have very high patient satisfaction. We have very good outcomes. In fact, health plans consider that we're very inexpensive relatively to how much chronic pain costs. In fact, the average dollar amount that a pain patient spends on a yearly basis is about $30,000 per year on healthcare costs.
Wow.
And we are super sort of inexpensive relative to that because we're successful in managing patients. So it's a very unique clinic, and we're very happy to see patients refer to us, but we also want to train you on how to manage these patients within your practices.
I think as I sit here and listen to you, Dr. Fricton, the training piece, the self-training piece is something that at least I don't always hear about in terms of when you're talking about care. That's something it seems to be very unique to your practice.
Yeah, unfortunately, it is unique to our practice because first of all, we want to make sure patients get better. And if 80% of their success is really based on what they do, and 20% is based on the treatments, you have to train patients to reduce those factors that drive chronic pain. And that's why we have a telehealth online training program, a risk assessment to identify those causes, and we do telehealth coaching to really provide that support for patients to make the changes that they need to make within their daily life. And so self-care is really critical. However, there's a lot of very good evidence-based treatments that we have out there. For instance, splints show significant efficacy if they're adjusted properly, they fit well, they were worn at night. We don't find that occlusal treatments work very well. Although if you have a major open bite on one side, obviously you're not chewing very well, it can add strain to the jaw, and occlusal treatments are needed, for instance, crown and bridge, orthodontics, etc. However, as an initial treatment, we do not use occlusal treatments. We first of all get the pain under control with a combination of splints, exercises, physical therapy, sometimes medication, and a lot of self-management counseling support on how to make those changes occur. And it's interesting, I have another patient that I saw on a telemedicine visit during this COVID-19 pandemic crisis. Our clinic is closed. And so we talked last time when we got together about telehealth. Well, this patient I have not seen in person yet. He's a 32-year-old gentleman who is from northern Minnesota, and he scheduled a telemedicine visit with me, and he had lots of jaw pain, clicking, popping, locking in the jaw, headaches, neck and shoulder pain, which is very typical of most patients. And so I saw him one time 3 weeks ago, and I just followed him up yesterday for a follow-up telemedicine. Now, I have not seen this person in person yet, but I was able to do a self-examination on him to really identify the diagnosis, get some of his past records to confirm that. And I went through not only an evaluation and explained the diagnosis, but also a simple self-care training program. Now, I saw him yesterday, and he had a couple years of pain. His pain within 3 weeks was practically gone. He was delighted. He said, I still have clicking in the joints, but the ear pain's gone, the headaches are gone, the jaw pain's gone. Now, that's a little on the unusual side. Most patients take 3, 4, 5 months or so for rehabilitation, but it's an example of how everybody can provide this type of self-management training within your clinic setting.
Okay. Thank you very much for that. That was awesome. That was really great information. The Dental Breakdown Show, sponsored by White & Associates Practice Consulting. Better business, better dentistry. They are a practice management consulting firm for dentists and other healthcare-related businesses. Their sole purpose is to implement proven strategies through online and in-practice visits and result in the personal and professional success of the dentist and his or her team. So, Dr. Fricton, why don't you give me the state of the union, so to speak, as far as the trends that are going on and that are affecting the orofacial pain in the dental marketplace?
Well, happy to discuss that because the American Dental Association has recognized how important it is now to broaden dentistry into new fields. For instance, they approved last year dental anesthesiology as a profession. And for instance, in Minnesota, we only have one dental anesthesiology. There's a great potential there. In addition, this year, the National Commission has approved oral medicine, which focuses a lot on medically compromised patients, oral lesions, clinical aspects of, and some orofacial pain also. Burning mouth is a good example. And then, of course, orofacial pain. And we need to recognize that dentistry, the profession of dentistry, is doing a very good job in helping on the prevention side. And what I mean by that, saying that if you look at the trends of prevalence data from 1988 down to 2008 and now in 2020, we find that adolescent, adult decay, caries, periodontal disease, and missing teeth have all dropped by about 50% in prevalence. Now, those are our critical sort of diseases that dentists provide care for. And if we continue to do such a great job with dental hygiene, oral hygiene, and preventing these diseases, dentistry needs to broaden itself. And these three new areas, anesthesiology, orofacial pain, oral medicine, are areas that we need to embrace. We all need to understand. In fact, right now we have a proposal to the Commission for Dental Accreditation for all dental schools to teach orofacial pain and TMD problems, at least to have one class in it and to have some clinical training and expertise in that, because we need to. So one of the big trends, of course, is to expand dentistry into these areas and realize that even though it's a specialty, specialties need to be recognized and by every dentist, and needs to be to some extent implemented for the more simple versus complex patients in their practice. So another trend that's really important in dentistry is this whole movement towards evidence-based dentistry. We really want to make sure that in the orofacial pain area that we don't do anything that is not going to be helpful for the patient long term, is going to be expensive, and it's not focused on really what works the best. And so there's a ton of evidence-based research, clinical trials on things that work well, including splints, physical therapy and exercise, cognitive behavioral therapies, certain medications can be very useful, surgery in some cases of major structural problems in the joints, all have a lot of evidence behind them, and we can certainly rely on that to make sure that we provide the best quality care. And then the other thing that's a trend that's going on throughout the country, in fact, the International Association for the Study of Pain has made the year of 2020 as the year of preventing pain. And so all of medicine now is following dentistry's example on the focus of dentistry, focus on prevention. For instance, in dentistry, we have dental hygienists that's what they do, is teach patients how to care for themselves, how to prevent oral diseases. In medicine, unfortunately, they have public health, which is sort of an academic area, research area part of it, but they don't integrate prevention very well into routine care. And so there is a movement in medicine and in dentistry, particularly within the pain area, to say, well, how do we prevent this delayed recovery and the development of chronic pain? And so those three areas, and there's a lot of things to do. There's a lot of research, for instance, on identifying these risk factors that drive chronic pain. And they occur in 7 areas or realms of our life. There's risk factors in the mind and body and emotions, within the lifestyle or behavior patterns we have, within the environment. For instance, I always talk to patients about, well, how do you avoid an accident while you're driving, which is one of the causes of chronic pain, is car accidents. Well, you give yourself plenty of time. You don't go too fast. You always make sure that you change the lanes carefully. We don't want to have accidents. And so we have a course at the University of Minnesota on preventing chronic pain. And it's at a website called Coursera.org, Coursera.org. And if you search preventing chronic pain and you search Fricton, I'm the course director of that. And we have had, it's a free course for anybody, and you can get continuing dental education credit for it. And we've had about 60,000 people from every country in the world take that course. And it has stimulated lots of research and focus on preventing chronic pain, just like dentists have been doing for the last 50 years. So we thank dentistry sort of moving medicine into that direction.
Wonderful. That is all really great information to know about. Those are trends that everybody can kind of keep an eye on as we look to the future. Now, our next topic is one that I've kind of been waiting for. I'd like to talk a little bit about you specifically in terms of your patients, the relationships you have with your patients, but most importantly, why do these people continue to come back and see you? What makes you so unique, and why do your patients love you so much?
Well, that's kind of a self-centered kind of question.
But it's good.
But the most important thing, and we all know this as every dentist and every health professional, is if you care about the patient, if you have compassion, if you listen, if you understand, and you really try to help them because of that sort of drive towards helping others, that is really what motivates most health professionals to get into this field. And I'm very proud to have trained many health professionals, dentists, in this field of orofacial pain. And I think that's probably the number one quality that they all have, is that they have this tremendous compassion for other people and they really want to help. And at the same time, from my perspective, how do I do that within the clinic? Well, when a patient first walks in the door, I introduce myself, I shake their hand, or really greet them and look at them and listen to them and say, well, how can I help you? I mean, those things are so important to say, that first sort of relationship development when you first get in the room. And then you say, well, tell me more. Tell me what else is going on. I mean, they may come in with clicking in the joints or locking. Then I ask, well, do you have any facial pain? Oh, yes, right, I do. Does it go down into the teeth? Do you have any tooth pain? Sensitivity to hot and cold? Is it causing any headaches up here? How about neck and shoulder pain and any other symptoms? So always asking the patient so you understand the big picture of what's happening to the patient. And then you get to know them a little bit about what are their risk factors, for instance, and we ask personal questions, stress to some extent, although we don't want them to imply or be implied that this is a stress-related problem. It is a physical injury, physical strain, physical problem that patients really need to understand. However, as we explained, there are factors that can cause the physical strain to continue over time. And so we explain the cycle, the pain cycle that occurs, that you have this physical problem, it's causing symptoms, but at the same time, there are things that either injured or strain the muscles, joints, and nerves. And stressors indirectly will turn the volume up on the pain, and that you get into this cycle. And we explain that to patients. So part of it is not only developing that relationship, that caring relationship, but it's also educating the patient on what is going on, what the condition is, how the pain cycle occurs. And the last thing is probably most important, is about teaching them how they can manage that pain long term. And that's probably what's so unique in our clinic, is that focus on self-care. Patients leave, they know what to do, and they're very clear about it, and then we support them over 6 months. And so, but it all starts with that relationship. It's very important.
You know, in the dental marketplace, Dr. Fricton, the fact that the relationship comes first is in some areas it's unique. It shouldn't be, but it is. Most patients, their biggest complaint when they see the dentist is knowing he or she didn't spend any time to me and no one listened to me. I think you would agree with me on that the listening piece is the deciding factor from a patient in terms of the quality of the visit in your office.
Very true. In addition to that, expectation is important. For instance, a lot of patients come in and they've had 5 years of pain, and they expect you to give them a medication, a drug that's just going to miraculously take away their pain. And so by educating them and realizing that it has to heal, and it's going to take 3, 4, 5, 6 months to really heal, and that so much of what encourages healing is to reduce those factors that are putting strain on. And so the bottom line, though, after 6 months is that the pain is either gone or minimal. And I have a story of a 8-year-old girl that was really funny. At my first visit, and her parents were there, and she's in the chair, and I examined her, and she has lots of jaw pain. She's only 8 years old. She has headaches. And a lot of times, young children will not tell you they have headaches or jaw pain. You have to kind of ask them. So every dentist needs to ask their young patients, do they have any jaw pain, tooth pain, headaches? Because it may all be related to a variety of lifestyle factors that they can control. So one of the things I asked them, during the visit after I examined them, explain things, do you ever hold your teeth together during the day? Now, if you say clenching, they interpret that as, but simply holding their teeth together will strain these muscles in the jaw and will contribute to the headaches. And she says, "What? You mean I'm not supposed to do that? I do that all day long." And so I said, "No, do not
No.
do that. Keep your tongue up, your teeth apart, let your jaw hang there like a hammock. Don't touch your teeth ever except when you're eating." And she says, "Oh my gosh." And so the next time she came in, children, adolescents, they get better fast. As soon as they stop the habits that are contributing to the problem. And clenching is one of them, or bringing their teeth together. So it's kind of a funny story.
That's a good story. That just focuses on the points that you've already made. That's great. You asked questions and you listened, and she went away feeling great. Awesome.
Yeah.
So I think the next question I would like to focus on, again on you, is talking about how you started and where you started and how you ended up to where you are today. You've kind of gone from average to great, and you've got a little bit of a story there about how you've overcome some things. And I think being the fact that here we are sitting here in the middle of an epidemic with this coronavirus piece, I think the younger dentist who's either sitting in school wondering, oh my gosh, what should I do? Or is scared, or people don't know what to do, I think could glean a lot from your story. So why don't you share that?
Well, I'm happy that you asked, because I've been a dentist since 1978, and I've been an orofacial pain specialist after my residency program in anesthesiology and pain management in 1980. And then I went on the faculty at the University of Minnesota till about 7 or 8 years ago when I retired, but continued to see patients. And it's an interesting background, I'll be brief, but when I was an undergraduate student at the University of Iowa, I was in pre-dentistry. And I ran a daycare center because I loved kids. I played around, so I would pick them up a lot, hug them, and things like that. They were all 2-3 years of age. Well, one of those times I injured my back, and I'm 6'3", 155 pounds, so I'm tall and thin. And it was really painful. And I had a hard time getting to classes. I was just a sophomore, it's not junior at that time, a junior in college. And so I thought, oh my gosh, I'm so young. How am I going to deal with this problem? And so at that time, I went to the doctor, of course, student health, and I went to a couple doctors, and they said, "You're too young for surgery. You have unstable vertebrae. So you should just do these sit-ups." And I tried sit-ups over and over again, and it just made it worse.
Ouch.
And at that time, so I just happened to be with a roommate who was taking a class in yoga. Now, this was in 1973. So nobody knew about yoga.
Nobody knew about that. No,
in 1973. So I thought, well, I should just try it. So, of course, I didn't go to the class. I just took his handout and looked at it. And this is similar to why I developed so many handouts for my patients, because sometimes they don't want to listen to a class. They'd rather just look at a handout. So I did the handout, and I started doing and I've had pain for months now. I started doing those within about 2 or 3 weeks, just like the stories of my patients. My pain completely went away. And I thought, what the heck? Why didn't the physicians know that this would be a very nice remedy for people with musculoskeletal pain? At that point, it perked my interest in pain and why the healthcare system doesn't seem to teach patients much about how to reduce that. And so I got into dental school. At that time, I wanted to learn more about alternative strategies. And one of those included acupuncture. And so I applied to get into a acupuncture program just to visit in the winter of Iowa of my junior year in dental school. It happened to be at UCLA. At that point, it was in a pain control unit that wasn't even in the medical school. And I learned about pain management strategies, including alternative ones, including hypnosis, acupuncture, yoga, and other things like that. At that point, it was fascinating to me, and there was nobody in the field of orofacial pain at the time. So when I graduated from the University of Iowa Dental School, I talked my way into the anesthesiology residency at UCLA, into the pain management program, which now had moved into the medical school. And I worked with Glenn Clark and Dr. Bill Solberg in the dental school at the same time, but I was primarily a medical school residency. At that point, I decided I needed to get a job after a 3-year residency program. And I think, well, what am I going to do in a field that nobody knows anything about? And so I just happened to have the dean of the dental school at the time at the University of Minnesota heard me speak as a resident and offered me a position here at the University of Minnesota. So I came here, started the program, the clinical, first of all, a clinic, then a training program, and I had Dr. Dennis Haley, Eric Schiffman, Dan Tilke as initial residents in that program. We also developed a research program, and it flourished from that point. And we were really the first, one of the first programs in the country. UCLA had a program. Kentucky with Jeff Okeson also did. And there's a variety of other programs around the country, but we were certainly pioneers in that. And we wanted to make sure that we broadened dentistry beyond the sort of drilling and filling. And so that we really focused on the whole orofacial structure. And we worked with oral maxillofacial surgeons very closely. We worked with oral medicine specialists. Nelson Rodas was very helpful. And we really helped develop this field. And at that point, then we wanted to make sure that what we did at the University of Minnesota could be translated into clinical practice. And that's why we set up the Minnesota Head and Neck Pain Clinic and have been providing care. And I still provide care there. Even though I'm retired from the university as a professor emeritus, I'm working with still patients 2-3 days a week and really developing strategies for which to integrate self-management training and prevention strategies into routine care. And that's where the speedtotreat.com, the pactforpain.com programs, which really integrate technology, digital technology, in a patient engagement platform that allows this to be integrated into routine care. But the most important thing about that development is that we've worked with health plans, and health plans have been very, very supportive of this because they know that when you integrate self-management training with treatment, that it provides long-term relief of the problem and saves billions of dollars in healthcare. And so they decided and have supported the reimbursement of this as a way to amplify or increase the success of care in all types of pain problems. So we work with TMD, orofacial pain, headaches, migraine. We also work with neck and shoulder pain and back pain within those programs. So it's interesting background.
That is. So for the younger dentist who's out in the marketplace right now, if you were to give them, some advice or some words of wisdom, what could you say to them right now, being the fact that we're in the middle of a pandemic?
Well, the advice I'd really make is to really stay calm. We have calming practices within all the training programs and realize that this is an opportunity to take a break, to reflect on yourself and your practice, on your patients, and really to establish what are your primary goals in life, within your practice, within helping patients, and focus on prevention. And so I've done a lot of work in research on what drives chronic pain and chronic illness in general. And interestingly enough, all the risk factors that drive chronic pain are also risk factors that contribute to chronic illness and decrease in lifespan and other problems. And so the whole focus on understanding yourself and your whole person really maintain balance in life. And I actually, as a hobby, I like to do art and I like to write. And so I wrote a novel. It's called The Last Scroll, and it talks about understanding the 7 realms of your life and how you can really, by that understanding, really maximize your enjoyment of life. And so this COVID-19 pandemic kind of gives you an opportunity to self-reflect, to take a break from the practice, and to really set your goals and your priorities up to maintain this sort of holistic health and well-being that is so important to everybody's life.
Thank you to Dr. James Fricton.
It's my pleasure, Christian. It's a pleasure to talk to you today, and I'm happy to communicate with anybody, talk to them about their interest in orofacial pain or prevention, wellness concepts. You can find me at mhnpc.com, or you can send an email. I still have a University of Minnesota email at frict001@umn.edu. So happy to help anybody, and if anybody's interested in a fellowship within orofacial pain, they should talk to myself or Dr. Corey Herman at Minnesota Head and Neck Pain Clinic.
Thank you for listening today. Thank you to Dr. James Fricton. I thought our conversation today on orofacial pain was very informative and very valuable to the private dentist. If you would like to contact Dr. James Fricton, please email him at frict001@me.com. Again, I'm Christian White of White & Associates Practice Consulting, Better Business, Better Dentistry. If you'd like more information on today's topic, you can contact us at whitedentalconsulting.com/breakdown. We'll see you next time on the Dental Breakdown Show.